Hello everybody, welcome to a special episode of Call the Vet. So this is normally my podcast that I do with recorded video, but I'm bringing it to you live from YouTube.
Welcome to the Call the Vet Show, the podcast that helps keep your furry family as healthy as possible so they can live the full and happy life they deserve. And here's your host, veterinarian Dr. Alex Avery.
It's great to have you all along. I know we've got David and we've got Disha watching live, so yeah, big hello to you, great to see you, and yeah, let us know where you're from, say hello in the chat, and if you do have questions, then just ask them and I'll try and get round to all of them. So this really is an ask me anything. I've got some questions that have already been submitted and been asked, and I'll get round to those in just a minute. But yeah, really, if you've got anything that you'd like to know, then just fire away and I'll do my best to answer you. I thought I'd start off with kind of a review of what the last year has been and what a crazy year it has been for all of us in so many ways. But the thing that I'm kind of most proud of and that I've had kind of has brought me one of the biggest pleasures is the interviews that I've started doing with some really fantastic people. Janelle, Mario, hi, great. Thanks for coming along. Let me know where you are as well in the chat, because I know there's a real global audience. Connecticut. Fantastic. So yeah, we've got a lot of members, a lot of viewers from the States, India, we've got UK, Australia, Philippines. I know there's people all over the world, which is just amazing, and kind of still blows my mind that I can be kind of talking to you from little lonely old New Zealand in the middle of nowhere. Yeah, it's really exciting. So yeah, the thing that's pleased me the most, or that I'm most proud of and that I've enjoyed, is really connecting with lots of different people. So we started off with Sarah Ondrako, who spoke about separation anxiety, which is a huge issue, and actually one of the questions that I'll come on to in a little bit. It's a really hot topic at the moment, and I suspect will be certainly for the next 12 months or so. We had Renee and Jim from Tripods, who are just fantastic people, and their passion is helping amputee dogs and cats. A lot of that is due to cancer, but for whatever reason, helping people make that decision, helping you, the pet owner, make that decision to, whether amputation is the right thing, and then how to optimize the health and the happiness of an amputee following surgery. We had Kat the vet on most recently, talking about how to buy a puppy the right way and how to avoid illicit breeders. And it's just amazing some of the lengths that they'll go to really con people out of their money and to give you a puppy milled, a puppy farmed puppy who's really not healthy, and you just end up supporting this horrible trade. Laylee and Kevin from Super Kit were fantastic and spoke all about the ideal cat collar and cat harness, and just as importantly, how to actually harness train your cat. So that's not something that I know anything about, and they brought some fantastic practical information. And then we had Dr. Meg Kelly, who talked about the importance of physiotherapy, which is also a really growing treatment modality that we can offer our pets, and it's really important, and it does a fantastic job for the recovery from so many different conditions, surgeries, but also for our older pets that are suffering from arthritis. Ms. Triz, we've got a question there. Steph, good morning. Great to see you all along. I always wonder when I do these things if anyone's going to turn up, and it's a little bit of an anxiety for me. So it's great to see you all here. I can see there's some questions, and I will get round to those towards the end. So I've got some things that we've got to get through before, if you like. So normally on the Call the Vet show, so I'll say normally, so we've had interviews, I've been answering your questions, so callthevet.org, and you can submit your question. It does sometimes take a little bit of time to appear on the podcast, although I do try and reply to everybody beforehand and give some pointers, so that you're not left hanging for months sometimes before the article comes out. But I had a question from Lance. So Lance's dog has got a couple of hot spots on his back, which he thinks he can get and can handle that, but there's also a lump between his shoulder blades close to his neck that's about the size of a quarter, which I believe is something like about that big, maybe. I'm not sure. I'm not from the States, obviously, but so it also has a hot spot on top of it, which is maybe a key piece of information. It's constantly broken up by his hair and him licking, and he's just given him a bath and whatnot, but he's really worried that this lump is a cancer because his dog's an older dog, and it really scares Lance, but he really can't afford to to go to the vets, which unfortunately has been a common problem and a common thing that I've been receiving requests about. You know, the times are tough for a lot of people, and I absolutely appreciate that. And, you know, my heart goes out to you if you're struggling like that, because so many people have been affected. But, you know, I've been personally quite isolated from that at the moment anyway. Certainly my family are all safe back in the UK, which is always a great relief. And New Zealand, we're so lucky to be pretty much virus free and life is normal. But I know that's not the case for a lot of people out there, and a lot of you may be struggling. It's really difficult though, and that's kind of why I wanted to answer the question on this episode, because, you know, we can talk about hotspots, and I've got a long answer here, but I kind of reflecting, I think it's maybe not the most helpful thing, because, you know, hotspots, they're a skin infection. We can clear that up by clipping the hair, keeping it nice and dry, letting the air get to it, and using a topical, either topical ointment, antiseptic cream, or even just a cleaner, so like a chlorhexidine based cleaner. If it's deeper though, it's probably going to need antibiotics, because and painkillers as well, because these can be really painful. But there's no way of me knowing what that lump is, unfortunately. The only way to know is to see if it clears up, if you can get rid of that hot spot, and see if it clears up. And if it does, then we can think of it as just a likely infection, a deeper infection. But if it doesn't, then really we need to do a fine needle aspirate, which is we take a little sample, we stick a needle in it, take a little sample and see what it is. And if it is a cancer, then that will, or most likely will, show up. And if it's an infection or an inflammation, then that will also show up, and we'll know that antibiotics and a longer course of antibiotics are the treatment. But, you know, unfortunately, there's not really any way to do that other than to go to your vet, and they obviously need to see you, they need to prescribe any medication, and they need to do any sampling. You know, there are various low-cost options out there. There's charities that might help. There's low-cost clinics. But unfortunately, it doesn't negate the need to go to a vet and consult a vet. So I don't really have any other suggestions, I'm afraid, Lance, for you other than that. And hopefully things will clear up if you can get those hotspots under control. It does kind of highlight the need, and I mean, it sounds like I'm on a bit of a pedestal here, but the need for kind of planning ahead. And I know a lot of people will also struggle with their own medical costs. Certainly in the States, there's no, you know, kind of National Health Service, or what we have over here, which is something very similar. But trying, if at all possible, when your pet is healthy, to build up a small savings account, you know, just a regular small amount into a bank account, and then you actually get to keep that money. Like, insurance is a great thing, but insurance is, you know, pretty pricey as well, especially if you have a bigger dog and an older dog. The insurance premiums can be astronomical. But, you know, trying to build up a bit of a buffer. So even if it's only, you know, a couple of $100, it will still get you a consultation, a course of medication, and maybe some simple testing as well. So there's some things to think about there, and I'm probably not the most overly helpful answer, but unfortunately it is what it is. So next up, we've got a question from Jones, who is actually a vet in Malawi. So great to have you along, Jones. Great for you to be involved here, and thank you for all the work that you do over in Malawi. I'm sure it's very different to the work that I'm doing here, which kind of reflects your question. So Jones is just asking, how do I manage a case of canine distemper? So he's had a frustrating experience with a dog that, according to the signs, it was suffering from distemper. So it had ocular discharge, so discharge from its eyes, fever, and an irregular heartbeat, a fast heartbeat. The simple answer, Jones, is that I don't treat cases of distemper. So I've been very fortunate that distemper in the UK is pretty much unheard of. I don't even know if people are seeing cases, but if they are, it's certainly very, very rare. And here in New Zealand, it's the same. So really, I'm not seeing distemper. We see occasionally parvovirus, but again, even then, that's only occasionally, because vaccination levels are high and vaccines work really incredibly well. So really, I guess my thought always is, if the treatment is not going to plan, is have I actually made the right diagnosis? And sometimes that's easier than others. Absolutely. Sometimes making a diagnosis is impossible. And a lot of the time our pets will get better without having made a diagnosis, but with giving appropriate symptomatic treatment and supportive care, and the body does the rest. And in the case of distemper, unfortunately, that's actually pretty much only the treatment that we can do. So we can give antibiotics. We can give electrolyte replacement, so we can give intravenous fluids to support that hydration. Support the electrolytes is really important. So often my understanding is these dogs are potassium depleted, so they need to be, potentially need to be supplemented for that. Trying to feed them is really important. Nutrition plays a really big role in any dog that's unwell, and especially if they're unwell and not eating for any length of time. We certainly know with parvovirus, it used to be that these puppies got starved, but we now know that if we're feeding them, even if they're vomiting, and they seem to be vomiting it all up, if we're feeding them, then it really does improve their chances of recovering from these horrible diseases. And then really good nursing care and any other symptomatic treatment. So anything that can bring down that temperature, painkillers, anticonvulsants if they're twitching, if they're having seizures, and a bit of a prayer sometimes. Unfortunately, these diseases, which thankfully we don't see globally, I know they're in different places, they're different prevalences, but thankfully we're seeing less and less of these as vaccination is becoming a thing. So not much help again, Joan, so I'm not doing very well today, am I? Fantastic. So next up, we've got some questions from Gurney Thor, and sorry, Gurney, if that is a terrible pronunciation of your name, who sent in a few different things, and we'll get going with those because there's some great questions. So what's the most interesting thing that happened in your clinic this year? Well, I guess it's been a year of change, hasn't it? And the most interesting, or the most different thing maybe, was the fact that we had to close our doors. We had to all dress up in protective clothing. We had owners that left their cat in their cage outside the door and then went back to their car before we could collect it, bring it into the clinic. And dogs were tied up on a lead. And so the same thing could happen, so that we had absolutely no contact with our clients. We then brought our patients into the consult room, examined them, called the owner while they were in the car, and had a chat, talked about the history, made the diagnosis, talked about the plan and the treatment, and then did that all in reverse to get their pet, their dog or their cat, back to them, which, to be honest, I hated. I know there's a lot of vets, and one thing I kind of wanted to talk about on a different video or podcast or whatever is there's a lot of vets who actually found that process, they quite liked having just the pet there and not having to deal with the public, the pet owner. But I hated it. So one of the big joys for me is actually communicating with people and building those relationships. And without face-to-face contact, it's really difficult to do that. It's also really difficult to actually know what people are thinking and feeling, and having a good discussion to make the decisions that need to be made. It made me realize how much we do actually rely on non-verbal communication, and how quickly you can read someone's body language when you're talking, to then be able to adjust any plan or suggestions and treatment going forward. So without being able to see people, I found that incredibly difficult. And obviously the whole process was pretty stressful anyway. So I guess that's the most interesting or different thing that happened. Thankfully for us, it only happened for, I think it was 7 weeks. Or was it 8 weeks? I can't remember. It seems like a lifetime ago now, but it was very short. And I know there are some people that are still having to do curbside service because of the level of virus in their community. It's very stressful for them, or it's likely stressful for them as well. So are there some animals that you're still afraid of? I'm not a big fan of spiders, but thankfully I don't have to deal with spiders. I've never had to. Here in New Zealand, we don't have a great deal of exotic animals that are pets. It's not really allowed. Dogs and cats is the bread and butter work that I do now. We'll see the odd rabbit, the very odd guinea pig, or pet rat, but really that's it. We do see some hawks in the clinic. So we the other vet is part of the Hawk Conservation Trust and locally, and so we get a lot of those in. We've had a couple of penguins, an albatross recently, and some gulls and things like that. But we don't see a huge number of exotics. In my last practice in the UK, we did see, we were kind of the exotics practice for the area, and we saw bearded dragons, tortoises. We had some massive Galapagos tortoises, which were cool to see. They really did look like dinosaurs. We had snakes and all kinds of different things. And then we did a lot of wildlife as well. So foxes, hedgehogs, pigeons, endless pigeons, So yeah, I'm not really scared of all those. I wouldn't say I know a great deal about them, but thankfully a lot of those problems with the exotic animals is the husbandry, so how we care for them. And the big thing is with the bearded dragons especially is that people would spend a lot of money on buying a bearded dragon, but then wouldn't spend any money on actually the vivarium and the UV light especially. And so it was actually a relatively simple fix to make some few husbandry suggestions and get that animal back to kind of eating and health. So, you know, it's quite easy from that point of view. But yeah, spiders, no, not so much a thing. And thankfully here we're not like Australia. And we don't really have too many spiders that we have to deal with. Typical life in the day of Dr. Alex Avery. Well, I guess if we take today as a typical day. So I'm up early. So it's 6:47 in the morning. So I was up at just after 6, knowing that I had the live stream. But my son also gets up pretty early and will often wake us up, although he's getting better and better at kind of sneaking down quietly. So up to do this, but get the kids ready for school, get ready for work, head into work. So I work 4 days a week. So Monday, Tuesday, Thursday, Friday. And it's about half an hour into my work. So commute into work, do my day job. So as general practitioner in a small animal, companion animal veterinary practice. We've just moved into a new clinic, which is fantastic. It's amazing, the space and the cleanliness and the light and the atmosphere is so much nicer than our old clinic. Then come home. So I'll either go from 8 till 5 or from 9 till 6. Then come back, have a bit of dinner. Hopefully it's, we sit down to eat as a family. Kids go to bed. And then 8:30, it's getting later as the kids are getting older because they're staying up later. I'll often be sitting down at the computer for an hour or two to maybe film some content, to edit some videos, edit some podcasts. Work on the computer for a couple of hours. I'll often do that in my lunch break as well. So have an hour on the computer in my lunch break working on our pet's health. Go to bed and then repeat it all again. So that's kind of a standard day in my life. As far as what I do in the surgery in my day job, if you like, we split our time. So we're kind of a 2-vet clinic, although we're growing, and we have a few more people joining us in the new year, which is really exciting. We split our time kind of 50-50. So 50% of the time we'll be doing surgery, that in the morning that is, and then 50% of the time we'll be consulting. And then in the afternoon, both of us are consulting. So I kind of do everything from the point of view of being a companion animal vet, so surgery, imaging, diagnostics, and then consulting. So a bit of everything, which I really enjoy doing. And I guess a lot of times people feel pressured maybe to specialise or to follow a particular interest, but really I enjoy doing, kind of having that mix. So that's what I do. Have you had a dog before, or are you strictly a cat person? So I grew up with dogs, actually. We did have a cat when I was younger, or a couple of cats when I was very young. But we've always had dogs. So we had Finn was our first dog. Then we had Guinness, and then we had Fergus. 3 dogs kind of in my childhood. All spaniels, all fantastic dogs, really enthusiastic, as you can imagine, being spaniels. And then I guess we rescued a cat from kind of in my first job, my wife did. It got brought into her clinic after being hit by a car and was never claimed. We've been kind of cat owners ever since. I guess I'm a big believer in trying to provide everything that we can for our pets to make sure that their lives are as happy and healthy as possible, as I say, kind of almost every time. And I know for a dog, it doesn't really, a dog wouldn't fit into our lifestyle at kind of this stage of life. We don't have the time to walk them as long and as much as we would like, and as much as they would need. And also we do kind of like to go away at weekends and things like that where we can't always take a dog. So, it just doesn't fit in with our lifestyle. I'd love a dog at some stage. I know the kids would absolutely love a dog, but I'm still very much a dog person, but I've also become a cat person. So I'm both, if I'm allowed. Next up from Gurney, have you noticed an influx of new dog owners where you are? Kind of here it's noticeable with the media. I'm calling them COVID puppies. I'm a bit afraid for some of these dogs and cats, but if there are families that really take care of them and they're happy, then all the best to them. So I've seen. So no, I don't think we've had the COVID puppy situation that has happened. I know has happened, and actually we spoke about with Kat the vet, one of the interviews that kind of 3 weeks ago maybe. We have had some new puppy owners, and we have had some dogs that really have suffered from a lack of socialization. So they've been, they just don't know how to behave, how to interact with people. They're maybe very scared, or they're a bit bitey. And yeah, they haven't really been socialized because of lockdown, because of the limited ability to do that. And maybe the owner's lack of awareness that that's something that needs to happen. Thankfully, it's not been a big thing, but yeah, it's definitely something that we have seen a little bit, and it is a bit of a problem kind of worldwide. What I'd say to you, if you fit into that category that you got a dog during lockdown and you haven't been leaving them, so separation anxiety is another big thing, which is why I wanted to speak to Sarah on Draco in that first interview about how to kind of solve the problem with separation anxiety. With any of these behavioural problems, all I'd say is that it's important that, one, if you're recognizing something, or have a little think, and if you're recognizing that your dog is a bit fearful, if they're getting anxious when you're leaving, if they don't like new situations, if maybe they're becoming a little bit aggressive in new situations or with new people, then jumping onto that really early is super important, because behavioral problems, they are challenging to fix at the best of times sometimes, but they're definitely really a struggle to put right if it's left and we just assume, the puppy's growing up, they'll get over it when they get older. Well, they probably won't. And not only won't they get over it, it will get worse. So trying to, seek some help. And sometimes this, it does take effort, but sometimes the plans that are put in place, are completely free. But it just takes a bit of time and effort on your part, but it's time and effort that's definitely well spent. Perfect. And then last one from Gurney was, besides being a vet and family man, what hobbies do you pursue? So, yeah, well, I guess I don't have a lot of time for hobbies at the moment. But you can see kind of behind me, where are we? So we like kind of tramping. So that's hiking. So I've got kind of little kettle, micro adventures, my little stove. It's hard to point to things when they're behind you and you're trying to look on screen. Little stove. We like to go hiking or tramping in the backcountry of New Zealand. So there's a huge network of huts that you can stay in overnight for very little money. Some of them are free. And they're very far away from the road, and you get no cell phone reception, and it's fantastic. And it's amazing, like some amazingly beautiful spaces. So we always did that before kids, and now that our children are getting older, so they're 8 and 6, we're starting to get back into that, and we've done one overnight tramp this year, kind of this summer season already, and we've got another couple planned for the new year. So that's something that we really enjoy doing, and it's great to be doing that and sharing that with the whole family. Other things, I enjoy fishing, fly fishing. So there's some great fly fishing opportunities here in New Zealand. Photography as well. So you can see the camera behind me. Something that I guess I don't have a huge amount of time for at the moment, but it's something that I do enjoy doing. And I'm sure it's something that I'll get back to, with any hobby, they kind of come and go, don't they, over time. So I guess that's what I kind of do. Otherwise, I'm involved with the Scouts section, Scouting New Zealand. I'm the Kia leader for our local group. The Kias are the 5 to 8 year olds. So my son has just moved from Kias to Cubs at the end of this term, which seems like a bit of a milestone, and my daughter's still a Kia. So yeah, it's a lot of work, and sometimes it's it can be a bit hard work and feel like it's not getting in the way, but there's a lot of other things that I need to do. But it's really enjoyable to see the kids grow and develop, and be a part of the community as well. So I enjoy doing that. And thankfully that's a term thing. So we're in the holidays now, so I get a bit of a break, 6-week, 7-week break from that, which was much needed at the end of this year. Perfect. So we've got a lot of questions here, so fantastic. So let's see if we can get to some of them all. Oh, we've got Lucy here. Do you want to come and say hello to everyone, Lucy? There's Lucy. She's just woken up. Hey? Right, off you go. Bye-bye. Bye-bye. So Lucy normally wakes up really late, so she's up early. Anyway, so, right, that's that distraction out of the way. Right, we've got here, let's see. Brenda, what's the best food to feed your dogs that you can buy At the Kroger. So I guess that's the first thing. I've got no idea what the Kroger is, Brenda, but is it if it's the supermarket or the shop? So it's difficult with, like, diet is always a difficult thing. It's a hot topic. And a lot of people have really strong opinions on it. I've written, kind of extensively, and there's a lot of videos about and podcast episodes about what to feed your dog, raw versus kibble, wet versus dry was the last podcast episode, I believe. I record a lot of them in advance, so sometimes I actually forget which ones are which. I tend to suggest sticking to a well-known brand rather than a boutique brand that you've never heard of or that's really super local. And the reason that I suggest that is because it's quite difficult to formulate a really well-balanced diet. And also, if we're formulating a diet, you'll see on the pack, it's the AFFCO, I think those are the initials, which is the American Feeding Company or whatever. We can get that it fulfills those requirements just from analysis. Now, if it fills it from analysis, now we don't necessarily know that those ingredients are actually able to be properly digested and absorbed and all that kind of thing. If it's from feeding trials, then we can be a little bit more certain of that. But also, if it's a more well, I guess, regarded diet, a brand that's been around for a while, they're going to have more resources to work on making a better diet, and it's going to be being fed to more animals for a longer period of time, and so you're going to be more likely to know if there's been any problems with that diet. So I guess that's a broad generalization. There's different diets across different different countries, and they're all going to be named differently in different regions. Even are all going to be named differently. So I don't have any particular diets for you. I feed my cats a Royal Canin neutered cat. I don't think you can go wrong with Hills, Eukanuba, ProPlan. There's lots of these different companies. A lot of them are all owned by the same umbrella company. So Mars owns a lot of them, but they're different brands and they're different entities. But I think a lot is made of feeding different foods, and while there's undoubtedly those foods are kind of the cream of the crop and the better ones, and there are going to be some that are really not great. So we have a lot of what we call dog roll here, which is like a big kind of extruded sausage in a plastic wrap that's often very fatty, and I don't rate that very highly at all. I think it's very tasty for dogs and they love it because it's full of fat and rubbish. But yeah, I don't really rate that very much. So, but I think a lot of the middle of the road diets, there's probably not a huge amount in it. So if your dog, and a big one as well, I think if your dog seems to be doing well on the diet that they're on, then why make that change? Obviously, if there's problems with tummy upsets, if their coat's not particularly glossy, clearly if they've got any medication, any medical history that means that they need to be fed a specific diet, then they need to be changed. But I'm not a big believer in changing for the sake of changing. I don't think there's a huge amount of evidence one way or the other with a lot of these diets that's set to say some are better than others. So I guess that's my quick take on that, Brenda, and I hope that helps. Right, Disha, let's see, we've got here. So from India. So if you see me kind of looking around, it's because, I've got a lot going on my screen. So you'll have to excuse me not looking right into the camera. But Disha, cat recently had a space surgery a week and a half ago. Is there any ointment I should put on the incision, area? No, it should be looking good. So if it's looking a little bit crusty and a little bit weepy, if it's like a clear fluid, then just cleaning it with warm salty water. So boil the kettle, let that cool down, add a bit of salt and give that a bit of a clean. If it's looking inflamed and if there is a lot of discharge, or your cat's not very well, or they seem to be irritated by it, then they'll need to go back to the vet. It might be that there's a bit of an infection there, or a reaction to the stitches, or something that needs antibiotics or something like that. But as a matter of routine, there's no need to put anything on any kind of surgical incision, unless you've been specifically advised by your vet. So sometimes maybe if there's been a wound, there's been a car accident, it's hit on the road and there's like a gravel rash as well as a wound that's been stitched, it might be that you've already got some cream been sent home with you, but generally there's absolutely no need to add anything to an incision. Right, we've got Ms. Triz from West Palm Beach. My dog has inflammatory bowel syndrome. What can I do to help her avoid getting an upset stomach? Irritable bowel syndrome. or inflammatory bowel syndrome. So we often call it IBD, inflammatory bowel disease, but I know with humans it's IBS, irritable bowel syndrome, which I believe is maybe fairly similar. I guess the thing is with a lot of kind of human terms that we use, it's a good point. A lot of human terms that we use, we don't necessarily use with our pets. And although we might consider the diseases or the symptoms to be similar, they're actually quite different diseases, which is why, like, when people use human terms, I'm not a human doctor, so I'm sometimes not aware of the exact intricacies of that condition. But really is going back to that diet, is trying to find the right diet that works. So we'll often use a hypoallergenic and exclusion diet maybe to start with, to find something that works, and then maybe slowly add ingredients back in to see if there's something that's a particular trigger. Hypoallergenic is not a protected term, so the bags of food in the supermarket, they might have hypoallergenic on it. They might also say natural. There's various terms that actually don't mean anything. They're not protected. They're not regulated in any way. So yeah, we would use something like maybe Hill ZD to start with, or an ID, or a intestinal or cannon intestinal. There's lots of different foods we would maybe start with, but really just trying to find a diet that works, and often we can manage them that way, especially if it's just a food sensitivity. If it's an inflammatory bowel disease, then we can sometimes get them, find one of those diets, and if that works, then diet is the only thing that we need. But if it's in a particularly bad case, or certainly in the first instance, then we do tend to need medical treatment as well. So that's normally with steroids, maybe metronidazole, which is an antibiotic that also has a bit of an immune modulatory function within the intestine, so it actually alters the inflammation within the intestine itself, as well as being an antibiotic. But yeah, diet really is the big one, Ms. So yeah, hopefully you can find something there. Steph, good morning and happy holidays. Morning, Steph, from Chicago. I hope it's not too cold where you are. It's probably deep with snow, if my geography and memory is right. But I hope you're staying warm, and it's and you're doing well. Janelle, one of my cats been diagnosed with eosinophilic granuloma complex. He's been on a high dose of steroids and a Topica, which is an immunosuppressant. Is there anything else I can do to help? So eosinophilic granuloma is an inflammatory condition, an allergic condition of the skin. Allergies, come in, I guess, numerous flavors. So flea allergic dermatitis is the most common one in cats. And either way, even if that's not the case, we want to avoid anything that's causing itch. So keeping up with your flea treatment, even in the middle of winter, even in Chicago, is really going to be important, because our houses are insulated, they're heated, and so we can still get parasites and fleas. With an allergy, it's an allergy to the saliva. So only one bite can sometimes really cause horrendous inflammation, and it can result in a cat tearing themselves to pieces. Maybe not so much when they're on the medication, but we want to do everything we can to be able to reduce the dose of that. But I guess being on steroids and Atopica, so that's a cyclosporin, being on both of those makes or suggests to me that unfortunately your cat does suffer from that pretty badly. We can give diets to improve the skin. So there's specific skin diets that can help, that have different supplements in them. Our omega-3 fatty acids are a really good supplement for skin. So that's our kind of fish oils, making sure that we're not giving anything that's got added vitamins or anything like that in it. And ideally giving a kind of a pet specific one, because they will have different additions to that. So we recommend something called Kotex, which is a pet. It comes in like a little pump. For a cat, that pump would last for 2 or 3 months, and it's actually pretty reasonably priced. So that's something to think about. Other allergies, I was talking about allergies. So other allergies are environmental allergies, so like our pollens and that kind of thing. So you might find that flares up at certain times of year. It can be very difficult to, especially in a cat, to avoid those things and to actually kind of do the other things like shampooing. We'd recommend, you can wash cats, and some cats really don't actually mind it. But other cats, you're kind of taking your own life into your hands by doing that. So diet, supplements, reducing any other itchy things. So also if you've got air fresheners in the house and that kind of thing, that can actually trigger allergies. Keeping everything nice and clean, as I'm sure you are already. So regular dusting, vacuuming, to remove dust mites. With food, I guess one thing that's important is food should only be open for, if you're feeding a dry food, that is, only feed a bag of food for about 30 days. The reason for that is that food inevitably gets some storage mites in it, and that can be a big trigger for allergies. So yeah, making sure you're getting an appropriately sized bag of food rather than buying a massive one, because it works out a bit cheaper, but 3 months later you're still using it. And then food allergies, not so much of a problem, certainly in my experience, in cats compared to dogs, but is potentially a thing. So yeah, hopefully that gives you a few suggestions there, Janelle. But yeah, it's a frustrating disease, and I guess finding a plan that works and sticking to it, because if you get back to stage 1, then you get the problem with secondary infections. So that can be bacteria or fungal, kind of yeast infections, and then you have to treat with antifungals and antibiotics and a whole load of other things, and it can be a bit of a challenge and an expensive job to get everything back to normal. Sorry, my phone just went, and I'm actually on call as well. So that's another thing that I do. So we do our own after hours treatment, after hours cover at the clinic. So every now and then, it's like 1 in 6, I think my rota is at the moment. I'm on duty so we have a normal working day, then we're on duty overnight, kind of fingers crossed that we're not called in, so that we can get a good night's sleep to be working the whole next day. So we don't have the luxury of, if we're on call, we get the following day off. We just have to get on with it. So sometimes when we get called in the middle of the night, it can be feel like a pretty long day the following day. I did get a good night's sleep last night, so and that wasn't a call, so we're all good. My wife pointed out to me I was on call, and normally we're pretty safe in the morning, so I thought I'd be safe for this stream. Anyway, Janelle, I hope that helps a little bit there. Perfect. Right, where are we next to? Let's have a little look. Mario, where have you gone? My chihuahua has no appetite and her belly is swollen. Please help. You want to know why? Mario, I'm afraid this is going to come back to really needing to see your vet. So swollen belly can be due to a number of things. We can get hormone problems. We can get liver disease. We can get cancers, unfortunately. A belly that's become swollen, especially if it's kind of been a relatively quick thing, unfortunately, those are often not the greatest diagnosis. Heart disease is another reason that we can get that, and we can get fluid building up in the tummy. So yeah, I definitely recommend checking with your vet if your dog's not eating as well. They're going to be pretty ill, but yeah, they really need to be seen, I'm afraid, Mario. And hopefully you get some good news. Certainly something like heart disease, if your dog's not on treatment for that, then treatment can be very, very successful. So it's not necessarily a really bad diagnosis that will be made, but I'm afraid there's not much I can suggest there, because the potential diseases are not ones that we can sort out at home. Brenda, what can I give my dog and cat for itching? They do not have fleas. So I guess that goes back to some of my previous answer from Janelle. There's a lot of things that can cause itching. So we can have parasites, we can have food problems, we can have allergies, which is probably the biggest one. We can have mites as well. If both of them are itching, I'd still want to make sure that your flea treatment is all up to date, because fleas, I have this on a weekly basis. I have people come to me because their pet's itching and they haven't seen that their pet does have fleas, and I run a flea comb through them, and picking up a flea comb is no bad idea. Run a flea comb through them and you either see the fleas or you see little black specks in their coat. So that's flea dirt. Now, the way that you can tell it's flea dirt is if you add that to a moist bit of tissue paper, and rub it a little bit, it goes like a rusty red, a rusty kind of brown colour. And that's how you know it's flea dirt, rather than just dirt, which would just stay a brown or a black or whatever colour it is. So they're really common. And I always think what a waste of a kind of a consultation for them, because if they just treated their pet for fleas, then the itching would have stopped. So I'd want to make sure. So not trying to teach you to suck eggs, Brenda, but yeah, if they're not up to date with flea treatment, I would definitely suggest you get that doing, especially with both of them. So with both itching, there needs to be something, or there doesn't need to be something, but it's likely that there's something that's affecting both of them, and fleas is really the most likely thing. Other things we can do, so we can feed diets, add some fish oils to make sure that their coats and their skin's not too dry, shampooing with conditioner, potentially just a standard oatmeal shampoo is great for just rinsing everything off the coat. It's nice and gentle, it doesn't strip all the oils, and conditioner can help kind of hydrate and keep everything moist as well. So I'd encourage, there's a lot of kind of questions to dive into deeper kind of detail in these things. I've got lots of videos about how to there's one how to treat allergies at home. There's one about kind of why was my dog itching. There's videos. So if you're on YouTube, just search for those on my channel. And there'll be some great practical tips there. You can also go to ourpetshealth.com, and if you just search for allergy or itch or skin, then you'll find those things. But same with diet and things like that as well. There's a huge amount of information in the back catalogue there that will hopefully help you all. So David, we've got, my phone is buffering, not good service. Is it uncommon for a dog to get a UTI just after getting over it? Bigfoot has a urinary infection again. So hi, David. So David's got Bigfoot and Arnold as well. I know Bigfoot's struggling. He's an older chap, struggling with mobility and a recurrent urinary tract infection. So no, it's not a simple urinary tract infection, David. It doesn't commonly recur after it's been treated. There's a number of things that can make it get more likely to recur. And that's not very good use of English, but make it more likely to come back. We can get stones in the bladder. We can have masses in the bladder as well. We can have kidney disease. Chronic kidney failure can cause a recurrent cystitis, a recurrent infection. Incontinence can cause that as well, because the tubes are open and it's easier for the bugs to kind of crawl up. Prostate disease as well in a male dog can make it more likely that we get a recurrent infection, because prostatitis, so the infection kind of sitting within the prostate, takes a lot longer course of antibiotics to get rid of. And if there's an underlying problem with the prostate, then it can make it more likely to happen again. It's a bit of a balancing act, David, because I know like Bigfoot's got lots of problems, and I know kind of that you're aware, that his time may be limited. So it's a bit of a balancing act between, doing what's right for him and, investigating these things. So if the antibiotics, and I've actually got a patient at the moment that's in a similar situation, if the antibiotics are keeping things going for the short term, and they help, then, and we don't want to do investigations because of everything else going on, then I think that's fair enough. But yeah, hopefully the next lot, if you're getting another lot, will make a difference. And if they're a bit longer, maybe, or, we also need to know that we're treating with the right antibiotic, and sometimes the normal antibiotic doesn't work. So that's where actually taking a sample and sending that off for culture can be really beneficial. And that helps us give an appropriate antibiotic. It helps prevent this superbug formation. So we really do need to be mindful that inappropriate use of antibiotics, so using the wrong one, using them when they're not needed, using them for a course that's not a length of course that's not appropriate, all makes it more likely that we get these multi-resistant bacteria, so these superbugs that then are a big human health concern, as well as being a concern for our pets too. So we really do need to be trying to have responsible use for antibiotics, and I know that's a big thought for every vet out there, for every doctor out there, and I know more and more people are becoming aware of that, both with themselves and not just going to the doctor to ask for antibiotics for a cold, but also with our pets. Excuse me, I'm just going to have a wee drink of my tea. Okay, so I hope that helps a little bit, David. And I know you've kind of struggled, kind of had a difficult time. So David, David's a regular viewer and always leaves comments under the video, which is fantastic. Please do the same. It really helps. If you kind of leave a comment, leave a thumbs up on the videos when you watch them. I really appreciate it. And if you could, spread the message and spread the word about what I'm doing, both on the YouTube channel, also on the podcast. I'd love to have more people on the podcast. It's got a pretty small but dedicated audience, which I really enjoy serving, and I really enjoy doing the podcast as well. So I'd love it if you could spread the word. David also hates spider with an undying, ever-loving passion. I'm with you there, David. I'm still the bravest in the house, though, and have to get all the spiders out of the house when they come. So I'm kind of slightly better than I was, but thankfully we don't have any of those massive ones. Mrs. W. 2 American bullies, and they've just produced their second litter of puppies. One of the puppies has a herniated belly button, and I'm concerned. So it depends on the size of that herniation, Mrs. W. So it's not unusual to have a little bit of an umbilical hernia. It's a very small hole that a little bit of fat kind of pokes through, and that in the early stages, at least, you can kind of push it up and push it back in. Occasionally, and it's very occasionally, and certainly in my experience, it's going to be probably a breed related and a genetic thing. But occasionally there is a bigger hole, and the risk, if it's a bigger hole, is that rather than just a little bit of fat squeezed through, and that's normally like a pinhead sized hole, actually a piece of intestine can come through. And the risk there is if it comes through, it can then twist and then get strangulated, which is a fatal thing unless we get emergency surgery. So I guess if you're concerned, if you feel it's a bigger hole, then getting it checked out by your vet will give you a very quick answer of whether you need to be worried or not. In my experience, 99.9% of the time, there's something that it's a little bit of fat and there's no need to worry. But that 0.1%, if you like, it is more of a problem. So it really depends on the size there, depends on where you're worried. And it might be that if you can poke everything back up gently, and if you can feel that there might be a little bit of a hole. Now, it's very easy for me to feel it because I'm used to feeling that kind of thing. It might be a little bit harder, but if you can get a feeling that there's a tiny little kind of pinprick hole and that's all that you're able to feel, then likely there's nothing to worry about. If you can keep pushing your finger all the way up into their tummy and your finger kind of disappears, then it's something that definitely needs to be sorted out. But chances are that's not going to be the case. If in doubt, see your vet. Kentama, nice to see you. Nice to have you along, Kentama. My cat has a large cell intestinal lymphoma. Sorry about that. She's on COT protocol on danzatron, serenia, tazapine daily for nausea. So for those of you who don't know, on danzatron and serenia are antiemetics, so anti-sickness drugs. Tazapine is an appetite stimulant. She's had bad nausea and appetence recently, syringe feeding now. A recent ultrasound showed there we go. Look, I can bring it up. So sorry, I thought that these questions scrolled for everyone to see, but that's why I'm reading them out. A recent ultrasound showed a normal abdomen. The vet thinks the chemo may be too much and reduce the chemo dosage. Could the long-term use of anti-nausea meds cause the nausea, lack of appetite? No, is the short answer. So chemotherapy is... So our aim with chemotherapy in pets is different to people in the sense that we don't give the really super high doses that we get as people, because our aim is generally not to completely eliminate that cancer. Well, our aim ideally would be to eliminate the cancer, but our expectation is that we kind of hold things at bay while our pet's quality of life is still really good. Occasionally we do get these side effects. The most common ones are, unfortunately, intestinal, so diarrhea, vomiting, nausea, and a lack of appetite. So ondansetron is a really good antiemetic, especially for chemotherapy. Serenia is also a really good one. So your cat is on good anti-sickness medication. If they're still feeling nauseous and with a lack of appetite, then it might be that actually things are a little bit too much and the protocol needs to be reassessed. I guess from the point of view of cancer diagnosis, if you're going to have a cancer diagnosed, then a lymphoma is the kind of the better one. It's the one that more readily responds to chemotherapy, and we certainly can get remission with that, which is really encouraging and great for those cats that do get remission. The latest kind of, as far as I'm aware, is that the average life expectancy for a cat is kind of about 9 months, but there is a reasonable proportion, maybe 20%, that are still alive 2 years later after kind of being on chemotherapy, and the COT protocol is certainly an appropriate one. It sounds like your vet really knows what they're doing. if they're giving chemotherapy, it's something that they're obviously comfortable with, and they're aware of managing that. So I'd really go with your vet's suggestion. It's not going to be those anti-nausea medications being given long term that's causing the problem. And it may be that one of the doses of one of the drugs needs to be dialed back a little bit, or having a bit of a reassessment of what that treatment plan is, I'm afraid, Kentama. But hopefully you can find something that, means that your cat's got a really good quality of life, because that's really what everything's all about and what the whole point of treatment is. Super Vegan Watt. Hi, Super Vegan Watt. We've recently rescued a 2-year-old cat that's been living outside. We think she has Puffy paw syndrome. She's almost no teeth. What are treatments and survival rates for cats with this? I've got no idea what Puffy paw syndrome is, I'm afraid, Super Vegan Watt. Let me just jump onto Google. Like, things get colloquial names, and things that are caused one thing in one country might be called something completely different in another country. Or it might be, a really local name. So let me just see. Puffy paw syndrome. Plasma cell Podo Dermatitis. Okay. So thankfully, this is not something that we see a huge amount of. They can be really difficult to treat, is the bottom line. Steroids can sometimes kind of be a really big help. So the plasma cells, it's one of the immune cells of the body, and so it's an immune mediated disease where the body's immune system isn't working very well and it's kind of attacking itself. Podo dermatitis is kind of a related, so podo is feet, and dermatitis is kind of the skin. So we get swelling, deformation, sometimes ulceration of those paw pads. And it can be really, really painful as well. The pads are scaly. They're puffy. So puffy paw syndrome. And treatment is antibiotics sometimes. So Doxic Cycling can sometimes help. Anti-inflammatories, steroids, or cyclosporin. So cyclosporin is that atopica that we spoke about earlier on, and that can help as well. So so I found in the cases that I've had that it can be a bit challenging to get it under control, but in other cases the response can be good. So it's definitely worth a go. If she responds really well, then you're going to know soon enough. And if not, then, it might be that you need to reassess things. So she's almost no teeth. I wonder what that's, that there may be more involved as well. There may be the stomatitis as well, where the mouth is all really inflamed, which is also an immune problem, where often we'll need to take all the teeth out. There's also a recent podcast episode on that as well. So hopefully that can help. Right. Also, Mrs. W. So we've got another one here. My male dog Bones is very intimidating. Is there a chill pill for these situations? If so, is it appropriate to use it on a regular basis? So I guess this boils down to a behavioural problem, a bit like what we were talking about earlier. Having a chat with a behaviourist. So it depends on the situation that you're talking about. Intimidating can mean, I guess, different things. If they're showing signs of aggression and all that kind of thing, then giving a chill pill. And there are some supplements that we can talk about, but it's not the be all and end all. So we need to think about actually having some behavioral modification plan to try and train them not to be like that, because if it gets worse, then that can lead to some tragic consequences. So a dog who's showing signs of aggression can deteriorate and become properly aggressive, and then even through no fault of their own end up biting somebody and then end up having to be euthanized, which is always always a tragic thing to have happen. As far as a chill pill, so there's different supplements that we can give. So Carmex is one, Zilkine is another, which are anti-anxiety medications. We can give Adaptil, which is a dog appeasing pheromone. So that's something that they can wear actually as a collar around their neck that can have a real calming effect, especially they're supplements and things if there's a stress related problem underlying things, rather than as a sedative. There are other things that we can give that are pharmaceuticals, but they'll need to be given in discussion with your vet, and again they'll need to have that discussion, and they should have that discussion about kind of behavioral intervention. There may also be a local behaviorist near you. If not, actually at the current point in time, there are behaviorists that are doing online work as well, so you maybe don't even need to have anyone round to your house, that you can can do that virtually. So yeah, those are some things to think about there. Right, so Daniel has had his cat die from FIP. I'm sorry about that, Daniel. FIP, feline infectious peritonitis, is a horrible disease. So GS441 is the new treatment for this. It's not licensed, it's a human antiviral, but it seems to have it seems to really help. Since I've released my video about it and about FIP, there's been so many people commenting that GS441 has saved their cat and their cat is still alive. Now FIP is really a fatal diagnosis, or it used to be a fatal diagnosis to make, but yeah, this is a new treatment. Like I say, it's not licensed. Maybe that your vet hasn't even heard of it, because it's really kind of one paper or so. As far as I'm aware, it's only a single paper that's shown that this helps. But yeah, I guess getting that word out, Daniel. So yeah, I'm really sorry about your cat. But yeah, the more people that know about that, it may be like, I'm not sure of its availability across the world. So it may be that unfortunately it's not available to you in your country, but yeah, it's certainly a new option for treatment of FIP, which is fantastic. Cool, there's loads of questions here, which is great. So I'm going to try and rattle through these because we've been going for nearly an hour. We'll keep going until I need to go to work, which is not for 40 minutes or so. So we've still got loads of time. But yeah, hopefully you're finding this valuable. Hopefully this all interests you. So my adult beagle dog, let's see, we've got Kristen here. My adult beagle dog usually walks sideways or against the direction I usually lead him to during afternoon walks. Is this a behavioural issue? How to address this? So yeah, it's a behavioural issue. I guess it sounds like it. If he otherwise walks normally, when he's off the leash, off the lead, he normally walks normally. He's not lame, he's not stiff, he's not got arthritis or any other mobility issue. Then it's likely a lead walking issue. Like what I'll do actually is if you search for the YouTube channel McCann Dogs, that's Ken and Kale McCann. I've certainly done, they've been over on this channel, and I've done things over on theirs channel, but they're fantastic dog trainers. They're based in Canada, but I'm sure I've seen several videos that they've done about lead walking, getting your dog used to walking on a lead, and they're your best, they're the best people to help you with that problem, Kristen. So hopefully that will, I'm sure you'll find something that will work there, that will get your dog walking nicely on a lead. Perfect. Everyone loving Lucy. Yeah, she's pretty cute, isn't she? She's 6 years old and she's starting to show a bit of attitude. Cool. So super vegan. Hopefully that answered your question about puffy paw syndrome. Mario Reds, great question. How can we help our pets go through the stress of New Year's Eve firecrackers, fireworks as well? Jump onto ourpetshealth.com, search for fireworks, and you'll find a whole list of strategies that we can do. In a nutshell, so ideally beforehand, if you know your dog has anxiety around fireworks, and the same goes for thunderstorms, any loud noises, then trying to desensitize them in the first place is the best thing that we can do. So that involves trying to expose them to those noises at a very low level, while they're otherwise distracted, and then gradually increasing the volume, if you like. So we can do that with just playing things on the TV or on the stereo, over your speakers, whatever. So that's the ideal thing that we can do, so just to try and desensitize them to it so that they're not bothered by it. If we know that if we know that fireworks season's coming up, then there's definitely still some things we can do. So we can get some supplies of the anti-anxiety treatments that I've just spoken about. So the Zilkine, the Carmex, the Activil, Adaptil. There's a flea treatment or a flea product called Activil, I think, and the pheromone is called Adaptil, and I think it's that way round, but I always get confused. It used to just be called DAP, dog appeasing pheromone, but they changed the name. It's probably a little while ago now, but when you've been calling something one thing for a decade or longer, it can be a bit tricky to change the name in your head. But anyway, one or the other. The dog appeasing pheromone that comes in the collar. It also comes as a plug-in like air freshener type thing. And getting that on board and getting that going for a few days before the fireworks happen. You can give it just on the day, but if you're giving it beforehand, it often will help a little bit more. If your dog is really, really scared, if they're, if they're really hurting themselves, if they're doing a lot of damage, if they're just sitting and shaking like a leaf, then going and seeing your vet and getting some decent drugs will really help them. Other things we can do, make sure that we exercise them in the day. Ideally in the afternoon, give them a really good run so that they're tired. For your cat, if they're outside cat, then make sure that they're coming in, try and get them in by the time dusk comes around and these fireworks are likely to go off, so that they're safe. Taking your dog out to toilet again before at dusk before the fireworks, so they're not busting to go to the loo and they're not going to have accidents and get stressed because of that. Closing all the windows, closing the curtains so that the sound is muffled and it's a little bit darker. They're not noticing the flashes. So sometimes it's also the flashes that will set these dogs off, because they know that those flashes are accompanied by explosion. So even if the fireworks are a long way away, if they're seeing flashes in the distance, that could trigger their anxiety, even if the actual volume of the bang is not particularly loud. Having a safe space for them to go, so that could be the back of the sofa if they're crate trained in their crate. Throwing a blanket over those areas to deaden the sound a little bit, also to provide a nice dark kind of safe secluded space. Having some background music on as well can help. You don't need to kind of crank the volume up, but just having a bit of background noise can help kind of drown out those sounds as well. And absolutely kind of your presence and just kind of reassuring them can help as well. Now some people will say that that only encourages them to display this behavior, but I think if they're showing that behavior while it's going on, it's absolutely fair enough to try and comfort them and to to help them through it. It might be that they'd rather just be away by themselves in their safe space. So yeah, there's a few things that you can do there, Mario Red. So hopefully that helps your pet stay safe. And yeah, it can be really, these guys can do a lot of damage to themselves. And again, I'd stress cats, make sure you keep your cat in. If you can't guarantee that your cat's going to be in the evening before everything starts, then maybe think about keeping them in even a few days before. Because we do have, and I've been on duty on call on a couple of bonfire nights, and invariably we get at least one cat that comes in that's been hit on the road because they've panicked and ran across the road during fireworks. So, we really don't want that happening to your cat. So hopefully that helps there. Right, Susan. Hi, Susan. Would there be any problem with me giving my 6 cats the dingo dental sticks because I'm on low income? Dingo dental sticks. I've got no idea what they are either, Susan. But yeah, dental sticks as a general rule, no, I can't see why there would be a problem. Dental sticks are, so keeping your cat's teeth clean, like, it's really important. So really well done for recognizing that that's important. Dental sticks are good for those animals that actually chew them and spend the time gnawing them. I find that a lot of individuals, dogs especially, but cats too, can either go and bury them in the garden, or they just bite them into big chunks and swallow those chunks. So they really enjoy them as a treat, but they're actually not doing a huge amount for their teeth. And if that's the case, it's probably not worth paying the premium for dental sticks. You're better off just giving them kind of some kind of treat if you want to. Other things that we can do for teeth. So brushing is the best thing we can do. 6 cats, you're going to be spending all day, every day brushing their teeth. But if you can do that, and that's something that you're interested in, then definitely I'd encourage you to do that. It's the reason why we brush our teeth twice a day. It's because it's the best thing that we can do. There are some diets that are proven to be better for maintaining kind of nice, clean teeth. And there are also some water additives or gels that you can kind of just dot on their teeth. That can help as well reduce the formation of the plaque and tartar, and I kind of liken those to kind of mouthwash for pets. So there's a few other things that you can do there. I was going to say something else, but I've completely lost my train of thought there. But yeah, hopefully that will help. So I guess it depends if they enjoy them and if they gnaw on them. Yes, it can be helpful. Various dental chews that I was going to say, so any product that has any evidence that it works. So I wouldn't say any product, but you want to be looking, if you're looking specifically for an oral health product, it will have a VOHC seal of approval, which is the Veterinary Oral Health Council. They also have a website, which is probably vohc.com or .org or something like that. If you Google VOHC, you'll find it. And they have a table of products that they recommend or that they have shown have a benefit for oral health. So if you search for that, and you'll find a number of things. Whether Dingo Dental Sticks is on there or not, I'm not sure, Susan, but you can soon find that out. Memory, hi Memory. Good to have you along. So David, Kroger is a big chain of food grocery stores in the States. I was in Kroger yesterday. Thanks, David. It's difficult for me having this global audience that, I'll know certain stores. I'll know probably the big ones like Target and things like that in the States. But, even the really big ones, I have no idea what they are. So, that's why it's quite difficult to sometimes recommend brands and things, because they do vary so much across the globe. Ms. Triz, her vet prescribed Royal Canin gastrointestinal. So yeah, hopefully that helps. And that's certainly one option there. But with changing diets for intestinal upsets or sensitivities, it can sometimes involve feeding multiple diets and trying multiple diets. Also, the difficulty is that we need to feed these diets often for 6, 8, sometimes 12 weeks before we know if it's going to work. So yeah, unfortunately, sometimes it can be a long term. That depends on the problem. If it's like a food sensitivity, then you'll often get a response much quicker than that. But if it's like a food allergy, then yeah, really 6 weeks is an absolute bare minimum, and 8 to 12 weeks is going to be better. And unfortunately, it can be be a bit of a time. Yeah, it can take a little bit of time to find the right thing that works. Super vegan. What about puffy paws? So is it safe to give a cat with puffy paw syndrome sub-Q fluids? I can't get her into the vet any sooner than Monday, and I do have a brand new bag and lanyard of sub-Q fluids. So if you know how to give that and you're worried that they're dehydrated, then I can't see any particular harm in giving that. It's important to be sterile. It's important that we know exactly what we're doing and how much fluid to give. But your vet should be happy to give you that information. If they've provided you with a bag of fluids and they know your cat, they should be more than happy to advise you whether that should be the right thing to do, as long as she's booked in for a consultation on that Monday. So I'd give them a call. But yes, I can't see why that would be a particular problem. There are other ways. I mean, if there are other ways that we can encourage our cats to actually consume and drink more water. So we can add some water to their food. Ice cubes can sometimes help. Boiling up some chicken or some vegetables and using the broth from that, and adding that to the water. And what you can do is you can actually store that broth in an ice cube tray, and so that you can, you only have to do it once, and that can provide you with a batch that will last you for a few weeks. And it's much better than stock cubes, because stock cubes have got a lot of salt in them. Even low salt stock cubes have got salt in them, and ideally we can be avoiding that. Running water is also great for cats. So a lot of people will leave the tap dripping. It's not great from a waste point of view. A really good thing is cat fountains, so they kind of recirculate the water, and cats love drinking from moving water as well. And then also just trying different bowls. So cats are really super sensitive with their taste, and can be pretty fussy sometimes, as I'm sure you know if you've got a cat. And so you try a glass bowl, a china bowl. Plastic bowls often will leave a bit of a flavour. Metal bowls will often leave a bit of a flavour, which is why your cat might not like drinking from those. And also having really shallow, wide kind of dishes almost, rather than bowls, because some cats, they're really sensitive with their whiskers, and if they're having to drink and their whiskers are being being touched, they really don't like that. And some people think that can actually be a painful thing that they're experiencing that stops them from eating and drinking well. Right, LF Antrida. Happy to have you along. So my pit bull has about a 1/4 inch sebaceous cyst that looks as if it's about to break open, and I don't have money to take him to the vet for a few weeks. If it breaks open, what should I do to maintain it? So sebaceous cysts. So if they burst out, it looks a lot like a grey, whitey, creamy cheese kind of material. And it looks horrible. If it's big, it can look really horrible. And it looks kind of like a pus, but if it's like that, if it doesn't smell, and it's often quite firm, then actually that's not a problem that it bursts out. It's just keeping it clean. What we want to avoid is getting a secondary infection. So keeping it clean, warm, salty water. If you can trim any hair away from it, just so that the hair's not kind of getting matted in the hole that happens when it bursts out. But yeah, that's really all that's needed. It will heal over. Chances are that sebaceous cyst is going to form again, and it will burst out, and we'll repeat that cycle. But if you're keeping it clean, then and it's not irritating your dog, then, that's all that we really need to do. If it's causing problems, if it's a recurrent problem, it keeps coming back and it's getting infected and your dog's really annoying you, then, saving up to get it removed is going to be a good thing. But actually just keeping it clean is the main thing there. Warm salty water again. You can add a little bit of kind of chlorhexidine, kind of rinse or something like that to it. But generally, if it's it's just keeping it clean. They're not normally infected to start with. If it's inflamed, the skin's inflamed around the outside, and your dog's irritated by it, then stopping them getting to it. So using like an Elizabethan collar can help, just to stop them kind of traumatizing it and introducing more infection. And it might be that they do need antibiotics as well. If certainly if it's puffy and inflamed, or if it's really weepy, then antibiotics might be needed. But yeah, hopefully that will help stop the problem before it even begins. Elephantrida. Super vegan what? Yeah, I think the clinical name is Podo Dermatitis. Yeah, cool. Austin Murphy, are there any CBD brands that you can suggest for dogs with arthritis or hip dysplasia? So there's a CBD and arthritis, CBD in general. So there's a CBD MD, I think. So if you look for a video of mine that's CBD, there'll be a link there. That is an affiliate link, which means if you do buy something there, I'll get a small commission. In the States, that is, there's certainly evidence that it can help, and that it does have painkilling properties. I think it's important. The whole topic of CBD is, I wouldn't say it's controversial, but it's a hot topic, because a lot of people, that's all they want to do for their pet, and they don't go and do all the other things that we know work really well. And we're still in the early stages of knowing actually how well CBD works. So we don't know how well it compares to, say, some of the other painkillers. So, I'd encourage you to work through it. And also, there's another video of mine that talks about the whole different arthritis management plan. So managing arthritis involves so many different things. So diet, weight loss is huge, supplements, exercise management, environmental management, changing their home, bedding, drafts, and then painkillers is clearly one part of that as well. CBD falls under that category, but there's a whole load of different painkillers, and there's no one size fits all either. But yeah, I think with CBD, with any CBD brands, you want to check that they've got independent analysis to show that there is the level of CBD that they're claiming, and there's not the THC. So the THC is the psychotropic chemical that causes dogs to effectively become high and people to become high. So that's in the cannabis. Now there may be benefits to THC as well, but that's that's something that's really an unknown. But CBD, the cannabidiol, is what seems to help, and it certainly does seem to help with pain. It seems to help with anxiety. There's some evidence it will help with epilepsy as well. And I'm a believer that we're going to be using this drug more and more in the future. Unfortunately, in a lot of cases, although I believe the situation might have changed in a number of states, vets' hands are tied and they're not actually allowed to discuss it. They're not even allowed to mention it, which is why it's not that your vet necessarily doesn't want you to use it, but they might not even be allowed to discuss it with you, which is clearly going to be a frustrating thing. But yeah, so there's that I think it's called CBDMD. But yeah, just checking that any local brand to you, any brand in your country has got independent analysis, because there's it's a big business, the CBD business now, and there's a lot of cowboys out there who are providing rubbish. And with the supplements industry in general, supplements are really poorly regulated, and time and again it's been shown that in some cases there's not even the active ingredient that's claimed to be in the product. In a lot of cases that concentration is not what's claimed, and so that's where independent analysis is important. And for different supplements, it's then important to use the kind of the better well-known brands that can be hopefully more trusted, but they'll hopefully also be able to provide you with some analysis if you do ask them. So hopefully that helps there, Austin. Primo Adono Vivo. My cat makes, sorry, that's probably a terrible pronunciation. My cat makes a sound like sneeze, like a sneeze, but not actually sneezing. No furball stuck in throat. What could it be? I mean, if it's Yeah, it could be any number of things. If they're not unwell and it's not been going on for a long time, I'd just keep an eye on it and I wouldn't be particularly worried. If it's happening all the time, if they've got discharge from their nose, if they're unwell, then, getting them checked out is going to be the answer there. It could be a little viral infection. So that's probably the most common thing that we'll see in cats that causes sneezing and kind of upper respiratory nose problems. They can get, cats will eat grass and they can sometimes get grass stuck. It kind of goes back up their nose. I've certainly seen that, and it's amazing the length of grass that you can remove from a cat's nose. That's going to cause sneezing, a lot of sneezing, and it's going to quickly develop into a snotty nose. If it's like a hacking cough or something like that, that's more like that, but more you're thinking like furball, then we can get things like asthma. Cats get asthma. And it's important to get on top of that because that can cause similar problems to people. So there's a number of things it could be. It depends on the situation there. Right, so Renita, I have 2 one-year-old Siameses, boy and girl, started to brush their teeth. The boy has softer stools for the past few days. Can it be from the enzymatic toothpaste? Indoor, eating well, lots of energy. Yeah, I mean, anything that we give differently orally, Renata, can absolutely cause a tummy upset. It's a bit like us if we're not used to eating a particular type of food, and then we go to the restaurant as a treat, then we might have a bit of a funny tummy the next day. So anything that we give can cause a bit of an upset. It's something that should settle down pretty quickly if that's the cause, and as long as your cat's eating and they're otherwise lively and they're not vomiting and you've got no other concerns, then everything should settle down and I wouldn't be particularly worried about it. But yeah, anything that we give orally, and that's medication, supplements, change of diet, toothpaste in this case, might cause a little bit of a tummy upset. But generally it's mild. They're happy and they're like your cat, eating well and with loads of energy. And Renata, you're in London. Hello from London. I hope you're staying well. And your Christmas plans haven't been disrupted too badly by the level 4. That I know so many people have. It's not very nice for everybody in London at the moment. I know from the UK and for everywhere across the world, but I know London is being hit particularly bad at the moment. Tom, hi Tom. My cat's squatting in the box. Nothing's happening. I give him wet food most of the time, now all the time. Are there home remedies? So cystitis in cats, that's what it sounds like, is often caused by stress. So this time of year is stressful for cats. We've got Christmas trees going up. We've got decorations. We've got lots of new things like that. At different, in other years we've had lots of people coming and going. So stress is a big thing. In the younger cats, certainly it's going to be the case in 90% of the cases. It's going to be a stress related problem. So reducing that, increasing water intake, great job there. So we've just discussed other ways to do that as well. So that can really help with a flushing action. So idiopathic cystitis or feline idiopathic cystitis, FIC, older sites might call it FLUTD, feline urinary tract disease. It's all stress related. So it's making sure there's enough litter trays, making sure we're getting that water intake. Some of the supplements that we've spoken about already can help. Feeding a urinary specific diet, a prescription diet, is definitely the best idea if it's a recurrent problem, Tom. So if it's not something that's just been a one-off, using Fellaway. So that's our feline facial pheromone, which is the cat equivalent of the DAP, the dog appeasing pheromone, if you like. So that's what cats release when they rub their cheek against objects, and it marks their kind of home safe territory. So if you kind of have an increase of that in the environment, it makes them feel really much calmer and safer. If it's one thing we need to be aware of with male cats, Tom, is that they can get a blocked bladder. So we get all this inflammation within the bladder that forms like mucousy, crystally plugs that then go and block the tube between the bladder and the outside world, the urethra. And that's an emergency situation that needs emergency treatment with a catheter being placed and everything kind of flushed through. So if your cat is seems to be painful, and if they're really not producing anything, if they're producing a few drops, what we'll often get with these cats is that because everything's inflamed, they feel like they need to go all the time, so they're going and they're squatting and trying to toilet, but there's actually their bladder's empty. So you're clearly going to, at times, you're going to see drips of urine come through. But if you're not getting anything, and if your cat seems to become unwell, if they're crying, if they seem to be really distressed, then for a male cat, this isn't a blocked bladder, isn't a female cat concern. But with a male cat, it's a life-threatening condition. It's one of the few real emergencies. So keep a real close eye on your cat. Otherwise, it's something that does tend to pass within kind of 3 to 5, 7 days tops, but getting treatment for it can help with help keep your cat a bit more comfortable. So yeah, give your vet a call, I would suggest, especially if it's something that is not something that you've dealt with before. Again though, if you head over to the website or the YouTube channel, just type cystitis, it will come up with a lot more information there in a lot more detail, so hopefully that will help you, Tom. Simran, my dog has epilepsy. So sorry to hear that, Simran. I don't know how to explain. I'm feeling so helpless. Epilepsy it's not all that uncommon in dogs. Actually, dogs can be treated very successfully for it. There's a number of different treatments. So phenobarbital, imopitoin. Sorry, I had a mind blank then, and I can't remember what the trade name is. I can't remember. There's a number of different things. Kepra, CBD we've spoken about can help. Different diets, there's some evidence that can help with diets rich in medium chain fatty acids. So that's things like coconut oil can help. But so if we can get those seizures under control, and normally our first line drugs, so our phenobarbital or our imopitoin, they do a very good job. Potassium bromide is another one that we'll often use as an addition if we need it. And those dogs can generally be very well controlled, and they can go on to leave a full, happy, normal life. There's a subset of dogs where it's really difficult to get those seizures under control, but they really are the minority. So although it's not a nice diagnosis to have made for your pet, it's something that we can generally treat very well, and a dog will lead a very good quality of life. So there's definitely hope there. Right, let's see. So TP, Merry Christmas to you, TP, as well. My senior dog was diagnosed with kidney ailments with high levels of creatinine. Other than that, he's 13 years old, and day by day he's going weak, especially on his hind legs. He's giving up on his walks, which isn't good for his kidneys and him overall. It's hard to see him struggling. How can I help him? It's difficult, TP, isn't it? Because if he's struggling on his back legs, you'd wonder, is there an arthritis problem here as well? And then it can be a case of trying to balance diseases, because if the kidneys are really not in a happy place, then actually giving our normal anti-inflammatories, painkillers, our non-steroidal anti-inflammatories, which normally do a fantastic job, is not going to be the best thing. But there are other painkillers that we can give. And that goes back to, I guess, some of those other arthritis management strategies that we've spoken about briefly. So, jump onto the site or search for the videos about that. With kidney disease, like feeding a kidney specific diet is the best treatment that we can give. It's a general rule, so it helps slow the progression of that disease. Increasing water intake is really important as well, because these dogs and cats as well, they're producing dilute urine, so it can be a struggle sometimes to stay hydrated. Especially if he's a bit painful and he's not as mobile, it might be that he's not eating as drinking as well as we would like. So some of those strategies to increase his water intake is going to be really important too. And really just keeping a track of him on a day-by-day basis. Unfortunately, our dogs live a lot shorter lives than us, and it's important that we always have their best interests at heart and know when to call time. Now, I'm not saying that that's now by any stretch, TP. I don't know without seeing your dog, but we need to think, are the good days outnumbering the bad, and are the treatment, if we're giving all of the appropriate treatments and it's not making a difference, then it may be time for a difficult decision to make. And I don't say that specifically for your dog, but just I think it's important to say that as well. And I see David is having a similar problems with you, and I know Bigfoot's struggling with his back end as well. So hopefully some of those things will help TP. Roger, so my pug's left back leg's twitching just to the slightest touch of his paw or the lower part of his leg. He pulls it back. He's walking normally and no limping, so he doesn't seem like he's in pain. Called vet today and they just told me to wait a week and make sure to not put too much pressure on it, like walking the stairs or jumping. So yeah, I mean, our pets can hide pain. It might be that there's just been a little bit of a sprain. If it's just his his paw or the lower parts of his leg, it might be that he's just kind of sprained things. If he's otherwise acting normally, he's not particularly limping, then I'd completely agree. I think a watchful wait, trying to rest. Like, so if we just sprain our, if we have a mild sprain in our ankle, it might twinge a little bit, but we're not particularly lame ourselves, and what we would do is we would rest. So we need to do that for our dogs, and that means that we need to do that for them, because sometimes they'll be feeling a little bit better, and so they'll then do too much, and then they'll go back to stage one. So yeah, I think that's fair enough. Keep an eye, and I guess we can get some other weird and wonderful and rare conditions where we get twitching and that kind of thing. But if the twitching, so keep an eye if there's twitching starts anywhere else, but I'm sure it won't. And yeah, I'm sure kind of a watchful wait is probably the best thing. I'd agree with your vet there. Sons of Namara, hello. 2 trips to the vet. My 11-year-old dog is suspected of having arthritis in his hind ankles, issues with lower spine. He's on gabapentin, Galliprant and CBD for pain. Any solution or just preservation game? So arthritis, yeah, I mean, there's no solution in the sense of there's no cure for it. The other thing I should say is that I do have a free arthritis email course, which is at, let me see, our Pets Health. I'll just see if I can find it. / I don't think it's going to be at that. No, arthritis. Let's just see if I can find the website for you. Yeah. So if you go to ourpetshealth.com /arthritis mini course, then that kind of walks you through, and other people who've been asking about arthritis, all of the different options there for treating arthritis. It gives kind of a broad overview. So yeah, painkillers are fantastic, and it sounds like you're giving a really good amount of painkillers, and that's a really important thing as well. Sons of Namara, so which is a really good job that you've done, is not to be scared of using multiple painkillers. So a lot of people that anxious about painkillers in the first place, against giving any painkillers, and then they really hate the idea of giving more than one. But sometimes that's absolutely what's needed if we really want our pet to be pain-free, and that's going to be the aim. Clearly, that's everyone's aim. They want to be their pet, their dog or their cat, as comfortable as possible, and sometimes that does involve giving multiple painkillers. But there are those other things that we can do that we kind of discussed and run through briefly. But yeah, if you go to ourpetshealth.com / arthritis mini course, then you can get there's a free email courses there as well. Disha Kitchen, how to manage extreme dehydration in a cat. So if it's an extreme dehydration, then really the only thing to do, the only thing that's going to make a difference is going to be intravenous fluid. So that's going to the vet clinic and getting hooked up to a drip and being rehydrated that way. Subcutaneous fluids, which you kind of mentioned briefly before, is a good way to stop a cat getting dehydrated. But if they develop dehydration to any degree, then it doesn't rehydrate them well at all. And the reason being is that the perfusion, so the blood flow to the extremity, so to the skin and under the skin, the body shuts that down to try and kind of preserve its all its resources. And so what you'll find often is if you give fluids under the skin, even a day or two later, that fluid is still going to be sitting there in a lump because it's not being absorbed. And then giving it orally, if your cat's really dehydrated, it might be that they're not taking it in orally, and getting them to take in enough and get that absorbed is a real struggle as well. So a really dehydrated cat, they need to be admitted and put on a drip. Right, let's see. I think we're getting down to the end of these. What age do Great Pyrenees have their heat? So our bigger dogs they'll often have their first heat a little bit later. So by and large, I guess we think of dogs getting their first heat at about 6 months of age, but our larger breed dogs, can be 12 months or sometimes even later than that. But it really depends on the individual, and within breeds there's a huge variation as well. And sometimes that first heat can be silent as well, so you don't notice any bleeding. If you don't have any male dogs around, entire male dogs, you might not notice any behavioural changes. But yeah, so often a little bit later than our kind of standard 6 months, if you like. So Kristen, so my dog often vomits yellow. So I think, Kristen, you asked about them walking on a lead earlier. So often vomits yellow, watery liquid in the morning, usually on an empty stomach. How to determine if that's a symptom of a serious condition or it just happens occasionally. There's a lot of things that can cause vomiting. And I guess if it's a regular situation, I'd be concerned, or certainly worth ruling some things out. And I think a blood test would be the first thing to do, Christine, after a physical examination, obviously. So your vet might examine your dog and find that there's something, find something that explains that, and a blood test, and then even potentially imaging. So x-rays, ultrasound might be the next thing, to talk about. But having a full history as well is important. So exactly when does this happen? What's your dog being fed? Is there any relation to food? Is it always on an empty stomach? Do they vomit at other times? What are their stools like? Do they ever get diarrhea? So the importance of a full history is really important as well. So yeah, definitely that's something to have a chat to your vet about, and it's likely that they might want to do a few investigations into that. Perfect. Ling. So Ling, my senior Yorkie has an eye ulcer that's not healing as good as our vet would like it to. He's had 2 rounds of antibiotics and he's waiting to see a specialist on the 29th. Unfortunately, I haven't been able to get an early appointment. He's not on any meds at the moment, only painkillers. Is there anything else I can do? I think if you're going to the specialist, then that's the best thing that you can do. With eye ulcers, so Yorkie cross. So some of our breeds of dogs, especially our brachycephalic flat-nosed breeds of dogs, their eyes are quite kind of bulbous and exposed, and that does leave them more prone to getting an ulcer on their eye. Other things, we can get inrolling of the eyelids, so we call that an entropion. And then the hair rubs on the eye, and that needs to be corrected. So a little bit of an eyelid tuck, if you like. We can also get dry eye. That's a common cause, and that's a lot more common than I think people think, where the tears aren't being produced appropriately, and so the eye's getting dry, and the tears aren't being produced, and that causes recurrent ulcers. And then we can get indolent ulcers, which is more of a boxer problem. We call it a boxer ulcer as well, but other breeds can get it, where everything just needs to be kind of debrided and kind of rubbed away, and sometimes little scratches put on the eye to encourage it to heal, which is something called a grid or a punctate keratotomy. So those are things that your vet's going to look at, that specialist is going to look at, and I'm sure they're the right thing. But if your dog is nice and comfortable, I guess the other thing we want to do is make sure that your dog's not rubbing their eye. So hopefully the painkillers or the anti-inflammatories are helping with that. But if not, then having a collar so that your dog can't rub the eye and make things worse while you're waiting for that appointment, is going to be a good idea as well. Perfect. I think we've got good evening, North London. Thanks from Wood Green. You're very welcome, North London, and I hope things are all right with you as well. Terry, so we've got a couple more. So I've just so Ileana, so that's a very similar problem. It sounds like to Christine. So hopefully that will answer your question as well. And then last but not least, and thanks everyone for all of these fantastic questions. It's so good. Like I said at the beginning, I always worry that no one's going to turn up and it's just going to be me talking to emptiness. So it's fantastic that you're here. I really appreciate spending your time with me and choosing to spend your time with me. So Terry, I have a 14-year-old hound with well-controlled Cushing's, but she's gotten increasingly picky about her food. Is lack of appetite a side effect of Cushing's? Veteril, I'm concerned about weight loss. So potentially, it depends how long she's been on it, Terry. I guess if everything's well controlled and that's suddenly happened, then I think it's unlikely that is going to be a problem with the Veteril or with the Cushing's treatment. Now, clearly, we're going to so with Cushing's disease, we'll get weight gain, and so when it's treated, we'll get a weight loss. As kind of reversing that disease process. So if it's kind of a normal weight loss from that point of view, then I wouldn't be overly worried. With the picky diet, I guess you want to check, like you're probably having regular monitoring blood tests just to check that everything's under control and there's no other problems going on. And so, if you haven't had one of those recently, then it's probably a good idea, because we're also, as well as dealing with medications, and there can always be side effects with medication. So I guess I always talk in generalities. That's not how you say it, but we've been going for 95 minutes now, so my brain is a bit fried. I was talking in general terms. But we're often dealing with older dogs as well, and the potential for a kidney problem or a liver disease or something else going on is certainly something. Dental disease is another really common problem in our pets that can cause a reduced appetite, dental pain. So having a look at your pet's teeth, if they're covered in brown tartar, if the gums are red, then that could be the reason why. So yes, I wouldn't say that necessarily it's a problem with the Cushing's disease. It may be that there's something else going on, but hopefully, if you're having monitoring blood tests, then that will hopefully kind of ease your mind about something more serious underlying. But having a dental check or just a general checkup with your vet, or even just giving them a call to check in with them, is probably going to be a good idea there, Terry. Fantastic. So I'm still in time for work, which is good. I've got a few more minutes. So there were a few other things I was going to talk about, and I'll just cover them briefly. So I wanted to kind of just talk about really kind of our pet's health and the plans for the future. And, I'd be really interested in your input, even in the chat, or send me an email. So you can get me alex@ourpetshealth.com if you're signed up for the newsletter, and if you're not, why not? But you can just reply to any newsletter. But I'd love to hear your thoughts on kind of the future of Our Pets Health. So I'm actually about to take some time off. I'm taking a couple of months off from the channel and from the podcast. So it's summer here. The kids are on holiday. It's been a busy old year and I need a break. So I'm taking some time off there. I'm also taking some time off to plan, so I'm not taking the whole 2 months away from the project, but I'm going to be planning what 2021 is going to look like. So I'd be really interested in what content that you'd like from me and what will keep you coming back to the channel or keep you coming back to the podcast, because I know a lot of people, they will, they'll search for a topic, they'll find the video, they'll enjoy that, but they, and they maybe even subscribe, but they don't really come back to watch other videos. So, that's something that I'm keen, because I think there's a lot of great information in a lot of videos, but if people aren't seeing them and watching them, then there's it's not getting the full benefit that it could do. So I'm going to have a little think about that, but I'd love to hear what you'd like to hear about, what kind of topics really interest you. I'm also working on relaunching the Our Pets Health Academy, so that's going to have a bit of a revamp. There's going to be a free resource hub. It's going to have a lot of great information that's going to be, like I say, free for everyone to access. And then I'm going to be working on a bit of a deeper dive in certain courses, more advanced courses for people who really want to kind of deep dive into their pet's health and make sure that they're doing everything that they can and have all that information in one easily accessible place. So I'd love to be able to do everything for free, but Our Pets Health, it's amazing how much money you can burn doing projects like this. And I can't keep doing it. I need to make things sustainable for me, both from a time point of view, but also financially. So, there's going to be some courses here. Also, if you do click on any links on the website or in the descriptions, if you go through my Amazon store or my resources page, those are all affiliate links. So they do, I do make a small commission. They're still products that I believe in. The number of requests I get to add different products and links and things from really rather ill-reputable companies is huge. So everything that I do link to, I believe in, but that does help support the channel as well. I've also got the merch. So I've got one here, the Our Pets Health hoodie. I've got a couple of different dog and cat t-shirts as well, and hoodies and vest tops and other things as well. So there's some face masks too. So anything that you buy there, really does help support the channel, and I really appreciate that. But if you're just here for the free stuff, then that's fine as well. I love having you along, and it's great to interact. So no pressure there at all. And then lastly, I wanted to say, having said all that, don't worry, I'm not going anywhere. I've already recorded a fantastic interview about sustainable pet ownership with a vet called Maddie. Hugely important topic, one that I'm becoming more and more aware of. Maddie was a fantastic guest. So I'm really excited to bring that to you in March, and that'll be on the podcast primarily, but also we'll have clips on the YouTube channel. And I've recorded several other podcast and videos answering other questions that have been sent in at callthevet.org as well. So I'm not going anywhere, but I need to take a big break. Now, I hope all that's left for me to say, because unfortunately I'd love to stay and chat a little bit longer, but I do need to get to work. I need to get properly dressed and get to work. But yeah, really, thanks for coming along. I wish you all a Merry Christmas, wherever you are in the world, and however you're spending that. I hope you're staying safe. I hope you're managing to get some time with your family. If you're not, hopefully that's around the corner. Hopefully these vaccines, get distributed well, and 2021 is an awful lot better. But take care. Really appreciate you all. Thanks for joining me for just over an hour. And until next time, I'm Dr. Alex. This is Our Pets Health, because they're family. Take care. Bye.
Thanks for listening to Call the Vet. For full show notes and any links mentioned in today's show, head over to callthevet.org, where you can also submit your question to be featured on an upcoming episode. We'll see you next time.